Thank you, everyone, for being a part of this press conference today. Just a couple housekeeping rules that we have. This is a hybrid news conference. So we have media here as well as media for joining us through Zoom on it. If you do have a question by Zoom, please enter it into the chat and we'll make sure it gets read to our representatives on here. So first, I want to welcome Mikhail Moore, Intermountain Senior Vice President and Chief Community Health Officer. Mikhail?
Thank you, Brad. Hello, everyone. I'm glad to be with you today. We're here to talk about collaboration to improve mental health and well-being here in our community, something that Intermountain's been focused on for several years. We regularly talk with our community about the greatest health needs that our service area is experiencing. And continuously, we are hearing about mental health and substance use needs as one of the highest, most important issues to solve together between health systems and our community. In fact, in every community, whether we're in a rural or an urban setting, underrepresented community or a majority community, this topic is foremost on people's minds. It affects nearly every family, nearly every individual at some point in their life. So in response to trying to address this need, Intermountain is focused on first, improving access to behavioral health services. And you're going to hear a little bit about how we're expanding that access today. Second, we also recognize the role that access to lethal means plays in our suicide rates here in Utah. So we are promoting efforts to reduce access to lethal means for people who are experiencing mental health problems. And then we're working to promote attitudes and norms that help normalize mental health and get us talking as a community about how we can work together to meet people's needs. Together, we really believe that we can improve mental health and well-being in this community and be an example for how to do so for our country. Intermountain's approach to improving access is multifaceted. We recognize that we need to expand our own services, and we're working to do that. And we know that underrepresented parts of our community struggle most to access behavioral health. And that underrepresentation might be because of ability to afford healthcare or to have insurance coverage, or because of language, background, gender or sexual orientation, things that make it harder to access care. Intermountain created a behavioral health network in 2011 that works to create community partnerships across our service area so that anyone who's accessing the emergency department because they think that's the only way to get behavioral health care can be directly connected to a community-based provider and have access to outpatient counseling, substance use treatment, and medication management. These resources have become really important for creating a better way of caring for behavioral health needs. And as years have moved on over the past 10 years, we've learned that we need more and different partners in order to reach some of those most underserved in our community. Today, you're going to hear from a couple of those partners who are helping us serve the Latinx and Hispanic community and the LGBTQ plus community. And we're really proud of the collaborative approach to reaching these communities. You're also going to hear that we know that there are lots of other ways to reach people and that COVID has taught us how to use virtual technology to improve access in rural communities, to some of these underserved communities, and really to help any of us who just don't know where to turn when we're in need of behavioral health care. And so you're going to hear about some of our work in those spaces. So here's how our run of show is going to go today. Next, you're going to hear from Doug Thomas, the Utah Department of Human Services Director, and he's going to talk about the role of human services in this work. He'll be joined by Ray Bailey, Youth Suicide Prevention Program Manager at Utah Department of Human Services, and she will speak on, or they will speak on LGBTQ plus suicide prevention coalition plan and efforts. Ray will be followed by Michelle Anklin, LCSW at the Utah Pride Center. Michelle leads mental health work for the LGBTQ community members and really understands the importance of addressing the needs in this community. We appreciate her work there. Javier Allegra will follow Michelle. Javier is the CEO of Latino Behavioral Health and is working to address mental health disparities among the Latinx population. Javier will be followed by Victoria Holmes. She is an Intermountain community health specialist and will speak to us in Spanish about the work that we're doing to reach this community, followed by Tamara Atala, who will close us up this morning. Tamara is the Executive Clinical Director of Intermountain's Behavioral Health Clinical Program and will speak to our work in telehealth and navigation and creating direct access to behavioral health in a virtual sense. So that's our run of show. We will take questions via the chat or as we close up this morning. Thank you. Doug?
Hi, I'm Doug Thomas. I'm the Director of the Division of Substance Abuse and Mental Health in the Department of Human Services. It's great to be here with you today. The mental health effects related to COVID-19 are profound and long-term effects are not yet fully known. The Division of Substance Abuse and Mental Health continues to see a year-over-year increase in the amount of need related to behavioral health conditions. People need care and are seeking out care in increased numbers, which is good, but we need to make sure that people know that there is access to care for them in the language they speak and with someone that represents them and can understand them and relate to them in their community. We saw the biggest increase in telehealth services last year between March and April of 2020 when the first restrictions came into place. At that time, in the public system, 234 people had been served via telehealth. And the next month, 14,000 people were served via telehealth. And those gains have continued throughout the pandemic. And we want people to know that they can be seen safely. If they're not comfortable coming into an office, they can be seen virtually. And many providers are providing virtual appointments. We also opened up the Utah Disaster Crisis Counseling line, also called Utah Strong. People can text or call 385-386-2289 for related stress and psychological first aid and counseling, and teams can be deployed statewide or virtually. And they speak a variety of languages. Mental and emotional health is key to our overall health. We need to make sure we're staying connected to and supporting one another. When we notice someone struggling, that we reach out to help them get the care that they need. Sometimes that's through informal supports, and sometimes that's through medical care and treatment interventions. We all deserve a seat at the table. Diversity and unity are not opposites. When we come together, we treat each other with dignity and respect and create unity and collaboration and connection. All protective factors that lead to individuals and communities and families getting help and feeling like they have access to care that they need. We've partnered together as diverse organizations to ensure that every Utahn in need has access to care. It's dangerous to delay care, and we encourage families and individuals to seek out care when they notice something is going on that needs to be addressed. I'm privileged now to turn over some time to Ray Bailey, one of our program managers, so they can share some of the work we've been able to accomplish together.
In the fall of 2020, Utah's LGBTQ plus suicide prevention plan was released. And it represents a collaboration between Utah's Department of Human Services, Department of Health, NAMI Utah, and the LGBTQ plus suicide prevention work group. And overall, it mirrors the framework of our statewide suicide prevention plan. Nationwide and in Utah, LGBTQ plus people have a higher rate and are at a higher risk for suicide compared to the general population, with transgender people experiencing a lifetime occurrence of 40% suicide attempts. Some other challenges that may exist in this community include family rejection and lack of access to appropriate mental and physical health care. This plan provides possibilities for all Utahns to contribute to improving the lives of LGBTQ plus youth and adults, from promoting more education about LGBTQ people to guiding employers to create more welcoming and affirming workplaces, to advocating for model policies at local and state levels, promoting positive mental health for LGBTQ people. As a transgender Utahn, I am honored to be part of this ongoing work and to see Utah's commitment to reducing suicides for all Utahns.
As others have previously mentioned, Utah leads the nation in suicide rates with 34% higher than the national average. The Trevor Project with data from the CDC also shows that lesbian, gay, and bisexual individuals are 3 to 4 times more likely to attempt suicide than their straight counterparts. And transgender individuals are 8 to 10 times more likely to attempt suicide. With those stats, it's important to recognize that LGBTQIA+ people are not more inherently prone to mental illness. Rather, we exist in a structure and a culture and a system of oppression that contributes to higher rates of experiences of PTSD, of depression, and of anxiety. To meet the changing needs brought in our COVID times, the Utah Pride Center, like many other organizations, moved all of our programming online in the past year. And this has allowed us to expand our access throughout the state and even throughout the country. However, there are still many people who have barriers to access, specifically financial barriers. We provide free support groups for a variety of different populations within the queer community. And those are open to anyone 18 and up, and we also have youth support groups. We also want to provide increased access to individual counseling and individual therapy, and Intermountain Healthcare has supported us by providing grant funding that has allowed us to serve over 300 individual hours of client work with face-to-face, one-on-one counselors at the Pride Center. We appreciate their support in removing the barriers to access so that people who have mental health needs can get them served without having to worry about their situation where they might be underinsured or uninsured. So we appreciate their support and look forward to continuing this partnership.
Hello, everyone. I want to start by saying thank you to Intermountain Healthcare for the invitation and for the collaboration. I want to lead on with a few stats. In the last 2-3 years, including the years of COVID, the demand for mental health or behavioral health services for the Latinx community has increased by 63%. And that's a very big contrast when you realize that the need for behavioral health services and mental health services for the rest of the population is only increased by 15%. So it is important for Latino behavioral health services to make sure that we're doing everything that we can to reach those individuals, especially the Latinx community, that are looking or searching for help and services that are not only language specific, but culturally appropriate. One of the major barriers to behavioral health services for the Latinx community is the insurance accessibility and income. There are other barriers that are primary barriers as well, like undocumentation or lack of employment provider health insurance. So for us, we have to be creative when it comes to providing the services we do, since they are free services to the community. And the best way that we know how is by partnering and collaborating with various organizations that have access not only to funding, but also to the services that the Latinx community is looking for. We're proud to say that we have been partners with Intermountain Healthcare for a number of years. But we also work with the Division of Substance Abuse and Mental Health. We also work with the Pride Center, which is one of our collaborators, and we have programs that are important to us because the intersection of Latinx and LGBTQ plus community is a very high risk population for suicide, depression, anxiety, and many other behavioral health disorders, including substance use. So it's important for us to know that our collaborators and partners at the table are thinking about our communities and are thinking about the gaps and the needs that exist to serve our communities. And for that reason, collaborations like this one and partnerships, broad partnerships with various organizations that serve different pockets and different population are important to us because it allows us to make sure that the Latinx communities is receiving the services that they need in the areas and in spaces that they exist or they live in. Ahora voy a hablar un poco en español y a repetir tal vez un poco de lo que dije. Primero que nada, quiero dar las gracias a Intermountain por la oportunidad que nos han dado de colaborar y participar e incrementar la habilidad que tenemos de proveer servicios para la comunidad latina. Como una organización sin fines de lucro y como una organización pequeña en comparación con otras, para nosotros es importante identificar las organizaciones en donde los latinos pueden ir a buscar ayuda y nosotros podemos colaborar con ellos. No tenemos la capacidad como una organización pequeña de poder abarcar todas las áreas en donde existen los latinos o donde los latinos buscan ayuda, pero con la colaboración con otras organizaciones como la División de Uso de Sustancias y Salud Mental, Pride Center y Intermountain, nos permite no solamente adquirir fondos adicionales para proveer los servicios gratis, pero también nos permite abarcar o ofrecer nuestros servicios que no son solamente lingüísticamente apropiados, pero que incluyen la cultura de la historia de nuestra latinidad y hispanidad incorporada dentro de los servicios de salud emocional y salud mental. Para nosotros es importante estar en la mesa, conversar con estas organizaciones y otros colaboradores para asegurarnos de que la comunidad latina sí recibe y tiene acceso a los servicios que tanto necesitan. Debido a COVID, la necesidad se ha incrementado tremendamente. Como dije en inglés, desde el 2017 al 2020, la necesidad para servicios de salud mental se ha incrementado 63%, que es un contraste muy grande comparándolo al resto de la comunidad, que solamente se ha incrementado por el 15%. Es por esto que colaboraciones como esta son importantes para nosotros y nos permiten continuar nuestra labor, continuar la expansión de nuestros servicios a través del estado de Utah y proveer un servicio de salud emocional y mental que es de calidad y específica para la comunidad que servimos. Thank you so much.
Hola, mi nombre es Victoria. Hoy queremos hablar de las iniciativas que Intermountain y los socios comunitarios están llevando a cabo para abordar los problemas de salud mental en Utah. Esto incluye brindar acceso a servicios de salud mental y ayuda a salud mental para las poblaciones minoritas y a las poblaciones que no tienen seguro o tienen un seguro que es muy caro para usar. El bienestar mental se ha convertido en una de las principales prioridades, especialmente porque los problemas de salud mental son tan altos y la demanda tan alta, especialmente con la pandemia de COVID. Hemos notado un aumento muy grande para la necesidad para estos servicios. Durante la pandemia de COVID, Intermountain vio la demanda subir para servicios relacionados al apoyo mental de los miembros de la comunidad y ha expandido su red de ayuda para miembros sin seguros y de grupos minoritarios, como escucharon Javier de Latino Behavioral Health, del Pride Center y de nuestros partners en el gobierno, tanto local como estatal. También Intermountain abrió una línea directa de ayuda para salud emocional en abril del 2020. Vimos que se usó mucho y la hemos expandido. Esa línea está disponible 7 días a la semana, de 7 de la mañana hasta las 7 de la noche. Cualquiera puede llamar, es una línea gratuita, hay disponibilidad en inglés, en español y otros idiomas. Tenemos traductores que están trabajando en esa línea. Cualquiera puede llamar y pedir ayuda para cualquier problema que está teniendo emocional. Tenemos gente que está trabajando y están preparados para ayudarlos, no solamente para hablar con uno, pero también para conectarlo a recursos. Estos recursos pueden ser gratuitos por nuestra red de bienestar o pueden ser recursos comunitarios. Si usted o alguien que conoce necesita esta ayuda, por favor, díganles que llamen a la línea. Estamos 7 días a la semana, de 7 de la mañana hasta las 7 de la noche. Y el número de esa línea es 833-442-2211. Muchísimas gracias.
Good morning. My name is Tamer Atala. I'm the Executive Clinical Director for the Behavioral Clinical Program here at Intermountain Healthcare, and I can't, this work couldn't be done without our partners. And let me start by saying that we know, as we've talked about, that our mental well-being couldn't be more important than now. We're just coming off the heels of our COVID crisis. The concerns continue to grow as we've been isolating, having challenges interacting at work because we can't go into the office, challenges with childcare because schools are unavailable. This has all grown to really creating a situation where we have incredible challenges. And so doing this with our partners is really, really critical. You now overlay those stressors with racial inequality, community concerns, or job losses. These are just a few examples that really have exacerbated our situation. In addition to that, navigating behavioral health can be incredibly challenging. Navigating, given your insurance and the tapestry of providers, can be incredibly daunting for individuals that are in a fragile state trying to seek help. So previously, we had the Emotional Health Relief Hotline, and that was really started back at the beginning of the pandemic. Between April 2020 and last year in April this year in April 2021, we took in about 6,500 calls. Now, in April, we converted that line to our behavioral health navigation hotline at 833-422-2211. And what this service provides is an opportunity to get a caregiver on the line 7 a.m. to 7 p.m. Monday through Sunday, 7 days a week, and understanding not only what the clinical concerns are, but help them navigate through the insurances they might have, whether they're uninsured, whatever those potential variables may be, to help connect them to the right service at the right place and time. In many cases, our community members go through this trial and error process as they try to engage in care, pull back, and try to find the right fit. This oftentimes leads to disconnection in care and really not getting the support that's needed. The goal of this service is to really help connect people and make a precise connection so that it limits that risk. Perhaps it's not traditional treatment that's needed. Perhaps education, support groups, digital technologies may be helpful for that individual. So we want to broaden those connections to really provide relief in the best way possible. In addition to that, we also launched Behavioral Health Connect Care. And this service also provides another video platform for individuals that need to speak to someone and don't want to wait for an in-person visit. That there's certainly costs associated with that based on insurances and copays, et cetera. But the key message for us is it's really critical for us to connect people to the services. So again, anyone can call the line. It's free of service. It's available 7 days a week, 7 a.m. to 7 p.m. And the number again is 833-442-2211. And those services are also available in Spanish. Thank you.
All right, we'll now turn it over to the Q&A on it. I would welcome the media that are here first. If you have any questions, they can answer. Then we'll turn it over to the virtual ones.
So COVID has changed Intermountain's approach to behavioral health in a few ways. I think one, we're really working to understand need in a different way. Needs have changed and in some ways, and we're trying to be really in tune with that. But we also, out of necessity, tried some new mechanisms for serving people. As Tamara mentioned, the Emotional Health Relief Line was originally stood up to serve our caregivers. As you might imagine, we were really worried about the stress on our own frontline caregivers as we were facing the beginning of the pandemic, all of the unknowns and questions. And so we staffed the Emotional Health Relief Line actually with people who were not working because we were not doing elective surgeries and elective procedures. And so we had a number of nurses and other techs and so on who wanted to help in any way that they could. And so we trained them to work the Emotional Health Relief Line. This helped us understand that we can train non-behavioral health professionals to serve as navigators with some training and equipment to help people navigate some of the complexities of our system, whether it's how to navigate if you don't have insurance, or where can you go depending on what your insurance coverage is. What tools are out there to help people manage anxiety and depression and things that might not require getting in with a psychiatrist or a psychologist. So we've really learned that there are ways to complement an already busy workforce that provides behavioral health services with some non-behavioral health trained personnel to help expand our access. And that's helped us create this behavioral health services navigation function so that we can create timely access for anyone and everyone, and then connect people with the right resource in a way that will serve them best. The other thing that we launched during COVID was a direct-to-consumer behavioral health telehealth product, Behavioral Health Connect Care. We accelerated this, frankly, because we were so worried during COVID about the ability to serve people virtually and the ability to meet people, meet people's needs when they knew they needed help. And so this is a direct-to-consumer virtual visit with a behavioral health provider to help manage an existing behavioral health diagnosis or a new concern. And that is connected into the broader Intermountain system so that a visit with a behavioral health provider in that virtual setting is connected to the continuum of care that we're able to offer in person and virtually along that continuum of care. So these are really, I think, two key important innovations in the way we're delivering behavioral health care that will continue into perpetuity.
Thank you for that question. It changed our approach because it made us much more aware of health disparities that just exposed them in a way that they hadn't been exposed prior to this. And so what we've done is we've pivoted and done a lot more contracting with organizations to reach communities that historically have been marginalized or have not had access to care because of language issues, or other health disparities that have separated them from the community, whether that be, any of the protected classes or any of the other things that we hold out as, making us unique and diverse. And so we've done that. We've also worked really closely with local mental health and substance abuse authorities throughout the state that are county-based to focus on telehealth and access to care through virtual means, which allows the workforce to see patients in a way that's unique for them and meets their needs. So you don't have to get childcare, or you don't have to catch a couple of buses across town or deal with an hour's worth of traffic. You can conveniently stop what you're doing in your home, go to a separate area, get on your phone or tablet or computer, see your provider, whether that's a therapist or a doctor or someone else, and then go back to what you were doing. And it isn't as big of a disruption. So we've seen no-show rates drops significantly, which is good for the person getting care, and it's also good for the providers who are trying to sustain their business. So those are some of the things that we've done, as well as really do an assessment. So right now we've conducted a health disparities assessment on the public system, and those recommendations will be coming out about the improvements we need to make so that we're addressing the gaps and the barriers that exist in our current system.
So during the pandemic, medical professionals have been particularly at risk for additional stress, strain, because of the nature of their work, as well as all of the other life experiences that we're all pretty familiar with during COVID. And so there's been a lot of efforts to think about how to support those professions as a community, and specifically at Intermountain as well. I've already mentioned the emotional health relief line that was stood up quickly, and as I mentioned, that originated with supporting medical professionals. But we've also gone directly into the frontline workplace and created separation spaces where people could reflect and step away from really the stress and pressure of delivering care in a COVID environment. If you imagine wearing a mask for an 8 or a 12-hour shift, and then experiencing the stress of difficulty communicating with your colleagues or with a patient who isn't able to have a loved one with them during our most critical times of restricting visitation, there's a lot of stress. And so just creating a place that was steps away from the ICU or the medical unit, where there was a couch, a quiet place to reflect, turn out the lights, and just be alone, was something our caregivers asked for. And it's really been well utilized. And that's space that we continue to support throughout our care delivery system. Our caregivers also really asked for things that would make them feel safe in delivering care, and therefore the healthcare community really responded with making sure we had personal protective equipment and made sure that we had safety precautions to protect their safety in delivering care. But in an ongoing way, there's a recognition that the needs of healthcare professionals are somewhat different than the rest of us, because they access care for their mental health needs often in the same places where they're delivering care. And that can be particularly difficult in terms of preventing someone from coming forward and asking for help or asking for care out of concern for affecting their job or their ability to connect in the same way with their coworkers. So we've been doing several things on that front. One, really ensuring that stigma or those barriers are not real. Making sure that we support people 100% who come forward for mental health services, that we make it accessible, that we give them time away from work to work on those issues, and that we provide private support as needed. And often that means partnering with other providers in our community so that an Intermountain provider might be served by another health system. And those other health systems providers might be served by Intermountain. And this type of reciprocity is something that we're very actively engaged in discussions around right now, so that we create really true access and eliminate any of those barriers, whether perceived or real. They prevent people from getting the help that they need. And then just like everywhere else in our community, the importance of talking about behavioral health openly is equally important in healthcare. We need to check on one another and make it okay to say, I know you're going through a really hard time right now. Do you need something that I can help you provide, whether it's navigation to a resource, time away from work, or some time in that private meditation space to get the support that you need. We need to be comfortable having those conversations, colleague to colleague, family member to family member, and even stranger to stranger.
And then we have a question for Michelle with the Utah Pride Center is going back originally to how did COVID change the mental health approach for the Utah Pride Center? Thanks.
The changes that we've seen with COVID aren't unique to the Utah Pride Center in terms of providing mental health care. COVID has exposed and exacerbated and amplified problems that were already there in our mental health care system. For instance, someone who's living in rural Utah, even if they have insurance, might not be able to take half a day off of their work to drive to Salt Lake City to receive affirming care. They might not have a queer affirming provider within a couple hours of their home. So that's an example of a barrier that was actually reduced in COVID when there were mandates that insurance companies had to reimburse for telehealth visits and provide coverage for telehealth visits. Another example of the ways that systemic level concerns have impacted individuals' care through COVID is, for instance, a college student who college classes suddenly ended. They moved home back out of state, and they lose their housing, they lose their support system, their friends that they've made at college. They also lose their therapist in many cases because laws and the legalities of licensure for mental health providers are often not reciprocated state to state. So if someone moves out of state, they lose access to that service that they've been receiving, and they lose access to that relationship that has really helped them through past difficulties. And then they're on their own to find a new therapist in their home state. So these are just a couple examples of the ways that the systemic level policies and regulations that govern mental health care are difficult, are barriers to service and care.
Then a question for Javier. So how did what programs have Latino Behavioral Health Services been able to start because of the contributions, but also talk about the COVID, how did that expose any health disparities or anything that you saw? Thanks.
Well, let me start by saying that that's a loaded question because we all understood that the Latinx community, and particularly minority communities, regardless of whether they are Latinx or not, experience health disparities at higher rates than the majority of the population. COVID, like Michelle was saying, exposed that tenfold, exacerbated some of the barriers and some of the difficulties of individuals accessing care, and really showed not only to us, but to the systems of care and the system of behavioral health care, how much those disparities really have impacted the mental health of minoritized communities in Utah. And I'm very pleased to be a part of some conversations and to be a part of looking for solutions and looking for approaches that might be helpful to minimize or eliminate these barriers and these gaps. In regards to the programs, I think the contribution from Intermountain came at a very good time because COVID had really exposed some of those barriers and some of those disparities, which in turn allowed us to provide free services to those individuals that were isolated due to the pandemic and were experiencing higher levels of anxiety, depression, and other behavioral health issues. So it has been also an opportunity for us to collaborate with many of the providers at Intermountain Healthcare, like IMC and the LDS Hospital, where we are working in collaboration with the providers and receiving direct referrals from them when individuals are either in the receiving centers or in their psychiatric units or in the emergency room due to a behavioral health issue. So I would say that we have been able to serve an average of 30 to 35 individuals, and each individual receives anywhere between 3 to 5 care hours. So it's about 150 clinical hours or service hours that we have been able to provide directly to individuals seeking support, emotional support or behavioral health support, mental health support. So it has been of tremendous help.
And then we'll close out with this question. This is for Doug. How can we increase reciprocity? Sorry, life flight going overhead. How can we increase reciprocity laws in Utah to help more mental health therapists, psychologists provide care here?
One of the things that Governor Cox has emphasized with his One Utah roadmap and health security plan is access to care. And one of those items that we're working on under that is making sure that we have professionals who are licensed and can take care of individuals in the state of Utah, both in urban and rural areas. And then with telehealth, reciprocity laws for doctors and therapists and a variety of different professionals are very important. And so the Utah Substance Use and Mental Health Advisory Council is working on reciprocity laws that will allow people to have a license in one state and with just a little bit of paperwork be able to be licensed in our state. And that will help both in recruiting good people to come here and work, but it will also help with telehealth as we have people working in other areas, especially in our border states, and being able to provide care for us and expand our workforce here in Utah.
And that concludes the news conference for today. A link will be sent shortly that has a recording of today's news conference, as well as the names and titles of everyone who participated. Thank you very much.